Washington state legalized medical cannabis in 1998. Recreational stores are not required to be endorsed for medical sales. An endorsed store must have medical cannabis consultants on staff, have DOH-approved product available for sale, and must be able to enter qualified patients in the medical cannabis registry. 420 Friendly has been endorsed since 2016. There are 12 qualifying conditions that have been identified by the state of Washington where patients may benefit from the medical use of cannabis products. HIV, human immunodeficiency virus, is a virus that attacks the body's immune system. Without treatment, it can lead to AIDS, acquired immunodeficiency syndrome. HIV/AIDS is a qualifying condition for obtaining a medical cannabis authorization in Washington state. This allows patients to legally possess and purchase cannabis for medical use, including for managing symptoms related to HIV/AIDS and its treatment. The Washington DOH oversees a voluntary medical cannabis registry. Patients can get a medical cannabis card from a medically endorsed retail store after receiving a qualifying authorization from a healthcare provider. Registration offers benefits such as excise and sales tax exemption on medical compliant products. A link to our video on how the database works and what you need to know about the benefits of having an authorization will be featured at the end of this video, or you can find it under the playlist Medical Cannabis. The program allows a qualifying patient to name a designated provider to purchase and/or grow cannabis on their behalf. Designated providers must also be registered and hold a recognition card. Studies indicate that cannabis may help mitigate several debilitating symptoms that affect people with HIV/AIDS. Appetite loss and wasting syndrome. Cannabis can stimulate appetite and help prevent or treat cachexia, wasting syndrome, a significant issue for some HIV/AIDS patients. Nausea and vomiting. It can help control the nausea and vomiting often caused by HIV/AIDS medications, which may improve adherence to antiretroviral therapy. Neuropathic pain. Cannabis can relieve neuropathic pain, a burning or tingling sensation caused by nerve damage that can be particularly resistant to other medications. Mood and mental health. It may improve mood and reduce symptoms of depression and anxiety that can accompany the disease. The cannabinoids in cannabis can interact with certain ART medications by affecting liver enzymes, which can alter the drug concentrations in the body. For example, cannabis use may reduce the effectiveness of some ART drugs like Reata's, atazanavir. Therefore, it is important to talk to your healthcare provider. It is crucial for patients to have an open, non-judgmental conversation with their care team about cannabis use. This ensures they are aware of potential drug interactions and safety concerns. Because state and federal laws on cannabis differ, it is important to understand the regulations in your location. Terpenes are being researched for their ability to help manage the secondary effects of HIV and its treatments, such as chronic inflammation, pain, anxiety, nausea, and loss of appetite. Limonene. This terpene, found in citrus rinds and cannabis, may help with anxiety and has shown antiviral properties in lab studies. However, limonene and other terpenes from citrus have shown both anti-HIV activity by inhibiting protease and toxicity to human immune cells in vitro, suggesting caution is necessary. Examples of strains high in limonene include Kush, Jack Herer, Super Lemon Haze, Cinex, and Wedding Cake. Beta-caryophyllene. This terpene, found in black pepper, cinnamon, and cannabis, activates the cannabinoid receptor 2, which is integral to regulating inflammatory responses. In lab studies, beta-caryophyllene has been shown to reduce microglial activation caused by the HIV protein TAT, which may help mitigate HIV-induced neuroinflammation. Examples of strains high in beta-caryophyllene include Bubba Kush, Sour Diesel, Gelato, Chemdog, Death Star, and GG4. Linalool. Found in lavender and cannabis, this terpene is known for its sedative and calming effects, which may aid in managing anxiety and insomnia. Examples of strains high in linalool include Do-Si-Do's, Lavender, Skittles, Grand Daddy Purple, and Amnesia Haze. Myrcene. Found in hops, mangoes, lemongrass, and cannabis, this terpene has pain-relieving and anti-inflammatory properties that may help reduce pain and inflammation in HIV patients. Examples of strains high in myrcene include Blue Dream, Granddaddy Purple, Grape Ape, White Widow, and Tangy. Alpha and beta pinene. Extracts from pine cones, which contain terpenes like pinene, have shown significant anti-HIV activity in lab tests by blocking viral entry into cells and inhibiting reverse transcriptase. Examples of strains high in pinene include Dutch Treat, Blue Dream, Jack Herer, Harlequin, and Strawberry Cough. Tetrahydrocannabinol, THC. HIV/AIDS often causes a lack of appetite, which can lead to involuntary and severe weight loss known as wasting syndrome. Tetrahydrocannabinol, THC, the psychoactive compound in cannabis, is well known for its ability to increase appetite. The synthetic cannabinoid dronabinol, Marinol, which contains THC, is FDA approved specifically to treat appetite loss and weight loss in people with HIV/AIDS. Nausea and vomiting can be caused by both the HIV infection itself and the antiretroviral therapy medications used to treat it. By helping to control nausea, cannabinoids enable patients to adhere to their medication regimens more consistently. Cannabidiol, CBD. Cannabinoids, including CBD, have been reported to help alleviate anxiety, depression, and insomnia, which are common among those managing HIV/AIDS. HIV can cause neuroinflammation and cognitive impairment by crossing the blood-brain barrier. In vitro studies suggest that CBD reduces the number of inflammatory molecules in HIV-infected brain cells, potentially offering a new way to treat HIV-associated neurocognitive disorders. More research, including human trials, is needed to fully understand the endocannabinoid system, phytocannabinoids, terpenes and flavonoids, their effects, benefits, and optimal usage. How they all work together and in what combinations. While progress is being made, it is important to always consult your doctor before using cannabis to treat any medical conditions, as it may interact with other drugs, particularly those affecting the central nervous system or metabolized by the liver. It is known that certain cannabinoids may enhance the effects of blood thinners and sedatives, and it could potentially alter the effectiveness of antidepressants and immune modulators. Thank you for joining us. We hope this information has been helpful and that you'll join us as we continue to explore the potential benefits of this amazing plant. Please hit that like and subscribe button and leave us a comment and let us know if there are any other topics you'd like us to cover. Until next time. Peace.